All right. Well, Dr. Peter Doherty, my name is Tom DiNella. I'm an internal medicine doctor in Nashville, Tennessee, and all the other times have been in person, but that's allowed us to bring in folks like you who are thousands of miles away to join us for our conference, which is very exciting. So we appreciate that. I was just going to give a brief introduction of you, and you're very accomplished scientist, and so, like I said, I'll try to keep that fairly brief in the interest of time. But Dr. Doherty is from Australia, and he's joining us from Australia. Are you in Melbourne or?
I'm in Melbourne. Yes, I'm actually at our beach house just behind Bass Strait, which is the body of water that separates the mainland of Australia from the island of Tasmania.
Ah, okay, yeah, down south. Okay, very nice. Well, anyway, Dr. Doherty got his bachelor's in veterinarian medical degree in veterinarian medicine from the University of Queensland, right, in 1966, and his doctorate in 1970 in pathology from University of Edinburgh, Scotland. And he's, as I mentioned, very accomplished scientist who did a lot of research, which I'm going to ask him about a little bit, at least, on T-cell immunity, for which he won numerous prizes, including the Lasker Prize in Basic Medical Science, which is often a precursor to the Nobel Prize, which he then won the following year in 1996, and along with his partner, Dr. Ralph Zinkernagel, right, from Switzerland. But Dr. Doherty, I want to again welcome you, and wanted to maybe just give us a little background about your research that you did, realizing that you're talking to mostly non-scientists at this and non-medical folks at this conference. So,
yes, I've worked all my career as a research scientist on infection and immunity, so particularly virus infections. And for 10 years, I did that in the veterinary world, and then I became a medical scientist when I went to a medical research institute and started to work with laboratory mice. So I became an MD, a mouse doctor. And that's what I've done. And while I was there, in my early 30s, I worked with a young Swiss, Rolf Zinkernagel, and we made the discovery that later earned us a Nobel Prize some 20 plus years later. And that is, we discovered the nature of how the body gets rid of cells that are infected with viruses. You know, viruses are inert particles, essentially. They can't even move themselves around. And to multiply, they have to get into our cells, and they take over our cells. With COVID, that would be at first up in our nose, get inside them and turn those cells in our nose into virus-producing factories, which push out more virus particles and infect more cells, and of course, allow the virus to transmit to others when we sneeze or cough. So basically, we discovered how it is that there are cells in the body that are called killer T cells. These are some of the white blood cells that go around in our blood circulation all the time. And what these cells are is the hitmen of the immune system. They come in and they kill cells that have gone wrong. It could be cancer cells or virus-infected cells. So they bump them off, and that stops, in a virus infection, that stops virus production. Very important in virus recovery and getting rid of the infection and getting better. Until a couple of years ago, I'm still associated part-time, but I'm emeritus. I'm retired from the faculty, but still hold an endowed chair. St. Jude, of course, is a wonderful institution and really an extraordinary place to work. It's and Memphis, very interesting place to live. I never lived in the American South, had lived up north in Philadelphia for a time, but I found it very intriguing to encounter Southern culture.
This is an Episcopal conference, like I said, and I understand you did at least briefly attend Episcopal Church in Philadelphia. Can you care to comment on any of that experience at all, or it wasn't all necessarily good? Yes, but that's fine.
We lived on the main line in Philadelphia. I was working at a place called the Wistar Institute, which is right in the grounds of the University of Pennsylvania, and was also involved with the University of Pennsylvania, which is a wonderful university. yes, they're very different. But then, of course, Memphis is very different from Nashville, which is
True.
again very different from Knoxville. So the differences are intriguing. And I turned down a job at Vanderbilt once, which was a very bad idea. I think it's a wonderful city, Nashville. But at St. Jude, I was head of the Department of Immunology. We did attend the Episcopal Church in Philadelphia. My wife was brought up as a Low Church Anglican, which is, of course, Church of England, which is, of course, the Episcopal Church gets its heritage from the Church of Scotland,
right.
not the English Church. And we did that for cultural reasons, because our kids were, particularly the tightness of the Jewish culture in Philadelphia, which is very, very strong and very big. We thought, well, they need to understand something of the culture they come from. So we did attend the Episcopal Church.
Okay, well, good. I was wondering if you could, I did want to, this talk is somewhat focused on sort of life after, or the whole conference is life after these sort of life transitions, like death and marriage and pandemics and those types of things. And I was wondering if you, just getting back to sort of life after COVID in your case that we were interested in, and sort of the parallels that you see with this pandemic versus the one, say, in 1918, and how that was impactful on the world. HIV has been, in a sense, a pandemic, but obviously a very different type of transmission and rate of transmission and that sort of thing. But kind of what your thoughts are, and whether you were surprised that we've gone really from 1918 to pretty much now before this wide-reaching type of pandemic.
Yes, we've had smaller flu pandemics than 1918. And as you say, I think of HIV as a pandemic which really started in the 1980s and is still continuing. It's kind of a grumbling pandemic, if you care to use those terms. I wrote a book about pandemics, what everyone needs to know, back in 2013 at the invitation of Oxford University, which puts out books like The Catholic Church, what everyone needs to know. That infinitely outsold my book, because everyone's all very curious about the Catholic Church, especially since books like The Name of the Rose and all those sorts of things. So, but I think the book is reasonable, but what it didn't really grapple with is the social consequences. I speculated that modern communication would allow us to work from home and all the rest of it, but I didn't really think in terms of what happens with small business and all these things that have come to the fore with this pandemic. So it's realigned a lot of my thinking. I hope that what we will do across the planet is learn from it. I hope we will learn lessons that impact on how we conduct our economic life, our social life, and of course, how we deal with a global infectious disease. I think there are great lessons to be learned, and this is an absolutely unique pandemic. In 1918, of course, we knew it was a virus. They called it influenza, but the first influenza viruses weren't isolated until 1930s. So it's a very long time. Now, with this virus, with modern technology, it was really first picked up in December, I think, in China. And by mid-January, the sequence of the virus was published globally. And people started to make these mRNA vaccines, which have been so incredibly good and fantastic. So anyone who doesn't take one of these vaccines is missing an opportunity to get great protection. So I think learning from this pandemic as a global community, it's difficult. We're organized around the world in nation states, but with pandemics and with climate change and with these big issues, we have to think also as global citizens and what we do about these things, because they impact the whole planet.
Oh, yeah. Well, in terms of, do you feel like our concern, of course, is that this is not the first time this is going to happen, where this widespread pandemic, there'll be another in the future, presumably at some point. Do you think what we've learned just in the past year with this, or year and a half with this virus, will expedite our, if we're faced with this type thing again, hopefully we've learned a lot of lessons about containing this thing, which the United States, as you well know, has not done a good job, done a very poor job at containing the spread of this virus. Australia, by and large, until, has done fantastically well, I think, and New Zealand, obviously. But in terms of, just the thought of future response to this type of thing, how things could have been done better. Your thoughts on that?
I think that's what needs to be done, and it needs to be done by people with expertise in very different areas, not just in science. With respect to the United States, you certainly didn't do particularly well early on for complex reasons and for some very obvious reasons we all understand. But basically, the US has done a fantastic job with rolling out vaccine. Getting people vaccinated was really the best, and the best vaccine in the world was produced in the United States, the Pfizer vaccine and the Moderna vaccine. I know the technology in the Pfizer vaccine came from Europe, but Moderna also made a comparable product out of Washington, really. So with vaccination, I think the US has done fantastically well. What's a bit scary with the United States at the moment is the number of people who are not taking advantage of these wonderful vaccines because, as I heard recently, a young nurse say from Arkansas, all their critical care beds were full. If all your critical care beds are full of COVID patients, there's no room for accident victims or heart attack victims or any of that. So people die from other things. So it's a very dangerous situation. So really, I would urge everyone to get vaccinated and to try to talk your friends and relatives and so forth into taking those vaccines. They're fantastic vaccines.
Well, there have been a lot of folks, as you know, in this country with a lot of hesitation about taking the vaccine. And a lot of it, unfortunately, I think stems from a lot of political views, quite frankly, unfortunately. But
yes.
I don't know if you have any thoughts about, has Australia faced that? Is it widely accepted to get the vaccine? I think probably better than the US, but are there people having reservations for certain reasons there? Or?
We do have vaccine hesitancy, particularly in some of the immigrant communities. We have a lot of immigrant communities who've come quite recently from particularly countries in the Middle East. There's a fair amount of vaccine hesitancy, and it's very important. Communication is enormously important. And what's enormously important with communities like that hold together and feel a bit separate from the rest of society as to have people of influence in those communities doing that communication. We've put a lot of effort into that, communicating with the right language, through the right people, having people of influence involved. We do have some anti-vaccination stuff going on, which is deeply embedded in the minds of some people. We can't seem to shift them on this. And there are various reasons for that, some rational, some not. But on the whole, it's certainly politically bipartisan. We don't have one party saying don't get vaccinated. And I think what's been happening in the US is really quite strange. And it's caused me to revise some of my thinking about particularly the political right. And I think I can't really get my head around some of what some people who should know much better are saying.
Yeah, I think that, and that's what I was also wondering what your thoughts are in terms of, not that you're a politician, and nor am I, but if you had any thoughts about how sort of world leaders in general have addressed this, and some countries maybe better than others, obviously, and whether anything could have been done differently from your perspective about how that could have been done better.
Yes, I mean, we have when I talk about saying we should look back on this after it's over, the point you raised earlier, I think what we have across the planet is a whole lot of different experiments. I mean, Boris Johnson in England is doing an experiment now. I think with about 70% of the population vaccinated, somewhere up around that, he's opening the country up, and quite frankly, the public health people in Britain are terrified. They think they're going to have enormous numbers of cases. This new Delta variant does infect people who are vaccinated, but generally it stops more than 90% of hospitalizations in people who have been infected. But vaccination, you can still get transmission from vaccinated people. So there are a lot of different experiments, and I think we should look at them and see what happened. What happened not just in terms of numbers of disease cases and deaths, but what happened to their economies? What happened to their social structure? I mean, what happened at the micro level to families? Even with a government which is pretty much on the political right in Australia and wasn't uncomfortable with the previous US government, we've provided very generous social support for people who can't work, which means they don't have to go out there, they don't have to get infected. And that's been a very important part of limiting transmission, as well as limiting cases. So if it's very difficult, I think. I'm not a politician, but since the Nobel Prize, 1996, I've been a lot on the public stage. So I have interacted with politicians, and I do put out opinions on all sorts of things that I don't necessarily have any great authority in. But I think that we need to look seriously at our political landscape, because in the end, policy decisions are extremely important in areas like COVID, climate change. We have to have government involved. Policy is massively important, and that's tended to be underplayed. We've underplayed the role of government to, I think, our detriment.
I mean, has the pandemic, in your minds, or the response to it, has that sort of, I'm just curious whether you think it sort of restored some faith in mankind, so to speak, your thought, or has it sort of been more to the detriment? Or
I think to some extent it's done both.
Yeah.
As a medical doctor, you talk a lot to people, so you're much more across the spectrum of human behavior and attitudes. My son, who's a clinical neurologist in Seattle, the complete nonsense and actually outright lies we've seen coming from some sectors have really surprised me.
Yeah. I was curious as well. I mean, we're starting to, in many countries, in Australia and the US too, we're starting to see a little bit of a rise again, right? And Australia is going back under, or some of the states have gone back under lockdown again, and that sort of thing, because of some increase, presumably due to the Delta variant.
Yes.
But I was curious about what your thinking is. That's probably totally changed from a month ago, maybe, about what to sort of expect over the next, 1 to 3 years kind of time frame with this pandemic, particularly. If you have any thoughts about what you think might happen.
Yes, it's really not very clear. I think the Delta variant, we think we will get back to very low case numbers or zero cases, but we're not sure. We would like to see, for instance, the US 70 or 80% vaccinated, because that would be a great experiment for us to watch from Australia. We're watching it. We'll be watching what happens in the UK very closely. I think these variants like Delta have emerged in what we call a virgin soil population. Delta's been around since December of last year, and it first emerged in India. So I think it's just a virus that mutated a bit, it grows better, and for that reason it's taken over. And it's taken over now across the planet pretty much. And I'm hoping that once we get enough people vaccinated and the virus hits an antibody barrier, that is from the vaccine, we'll see where the virus does mutate, it'll be less fit. That is, that it will multiply less, but we don't really know. So we speculate, but it's an experiment that's going on around us, and we don't really know what was happening. This pandemic, we've done something we've never done before in any situation like that. That is, we've tested people just to see whether they've got the infection, not to see what infection they've got, but we've done enormous amounts of screening of people in the public community to try and trace contacts and so forth. So we've frequently had diagnosis that is very specific from the PCR test, that we can then follow through. And we know some people are totally asymptomatic and they can transmit. We know some people with mild infection can transmit a lot. We know that a lot of people who get an asymptomatic or mild infection can get this horrible long COVID, which leaves people debilitated for months. And we don't know how long that will last, particularly in young people. Long COVID is causing debility in anything up to 30% of the population for some time. And then maybe in the long term, in 1 to 10%. We don't really know.
You know, do you have any thoughts about, I realize that this is maybe not exactly your field, so if you don't, that's fine. But in terms of the medication, that we might be able to develop, so that, sort of like we do with, a lot of patients are familiar with Tamiflu for influenza as treatment and prevention. I mean, you can use it as prevention, as whether there might be something like that might be a possibility for these coronaviruses and other, paramyxoviruses and whatnot.
Yes, I've been writing a little weekly column for our website since early last year. It's now up to number 66. And the very latest one, I wrote exactly about this. Where are we with specific medications like Tamiflu? If Tamiflu, as you know, as a physician, it's an antiviral which stops influenza, and it'll stop all the influenza viruses. There's a whole spectrum of different flus that the flu vaccine normally has 4 different viruses in it. So it works right across the board. So we need those drugs for the coronaviruses. But the thing is, with influenza, you have to give Tamiflu right at the beginning. If you give it after a few days, it's really useless. So you have to hit the virus right at the beginning. Now we're PCR testing people, picking them up as very early, and we could treat them if we had a reasonable drug. There are 2 drugs going through trial now in the United States, one with Merck, one with Pfizer. They're both oral medications, so you can take them as a pill. So they're the first antivirals that have really gone into major trial, apart from the repurposed drugs like hydroxychloroquine and remdesivir and all these other drugs. Right. And we're hoping they'll go forward. I think there'll be a lot of drugs come forward, but it's taken more time than I thought it would. The vaccines have been remarkably quick. And as we've now had them in millions of people, we really know what they're doing. So, but the drugs have taken a lot longer. We need the drugs as well, I think. And we need to be able to, particularly if we identify someone who's in a vulnerable category, who gets infected, the elderly, immunosuppressed, we need a drug we can give them right at the beginning. As you know, the drugs we've had out there at the moment are things like low dose, like heparin, because this disease is more complicated than flu. The virus gets in the blood and gets around the body and causes horrible blood clots. So anticoagulants are important, and corticosteroids to decrease the inflammation and so forth. But the one specific drug that was used was the monoclonal antibody given to President Trump. He was given 8 grams of a very specific monoclonal antibody, and he got better very quickly. These are very expensive drugs. They are there, but they're biologicals rather than small molecules. But we can't roll those out for everybody, obviously. We think that having a T-cell component in there might give you more rapid recovery, but none of the vaccines are emphasizing that at the moment. They're emphasizing the antibody response. That is these molecules that float around in the blood, and they grab hold of the virus and they target it for destruction or stop it infecting the cell. So that's our main protection. Now, the vaccines are against the original strain of the virus, the Wuhan strain. They're against one part of that, the spike protein. So there's only one of the viral proteins in the vaccine, and they're targeted particularly to what we call the receptor binding domain. Now, the vaccines against the Wuhan strain, as the virus has changed due to mutation, are still doing a pretty good job with the Delta variant, and they're stopping 90% of people who get infected from being hospitalized, but they're certainly not stopping all infection. So I think we'll see, I think Pfizer, for instance, must have a Delta variant vaccine in development and trial. It shouldn't need to go through the big trials that were done before. And hopefully that can be rolled out pretty soon, and that will give people better protection. So how much we'll have to do this, we don't really know. but antibodies are the main protection. Antibody levels following infection can be very, very variable. Sometimes they're quite good, sometimes they're very, very low. And the vaccine actually gives you a better response. And in fact, people who've had COVID, it wouldn't hurt them to get vaccinated at all. It'll boost their antibody response up.
The Delta variant, I don't know, but he got very sick. I was in the ICU last week. His wife is in the ICU right now, you know, and they had already had positive antibody tests from earlier in the winter and thinking they were good, and they had not gotten vaccinated, which the CDC, at least here, recommends after 3 months getting vaccinated. And is that, so that's something you would?
Oh, absolutely. You know, it's what we call immunological memory. You know, the antibodies are produced by big cells called plasma cells. They sit around in the bone marrow particularly, and they pump out these antibodies, but they're renewed too. They don't last forever. They're renewed from cells we call the memory B cells. Now, when you get a booster shot, you know, your first and second shot with the vaccine, for instance, firstly, you create some of these memory B cells. Then when you get the booster shot, you multiply them up to a much higher level, so you've got a lot more of them. So if you've had an infection, and we think that in some people, the infection is basically compromising the immune response to some extent. And we've known since mid last year that people who've been infected can be reinfected. And now, of course, with the same strain, but now, of course, we've got a somewhat different strain, so they can certainly be reinfected.
We will air this. We're recording this today, July 20th, and we'll air it. It's about a month from now that we're actually doing our conference. And so I think everyone will enjoy hearing your input. And I really greatly appreciate you joining us out of your busy schedule. Because I know you've written numerous books, and I mean just articles and everything. So I really appreciate you sharing your time with us.
Well, a pleasure to talk. And the final message is no matter who you are and whether you've had the infection or not, get a shot of the vaccine, and preferably 2 shots, because it's a great vaccine and it's a great triumph for American science and industry to have that vaccine out there around the world, the very best vaccines.
Oh, great. All right. Well, thank you very much, Dr. Doherty.